All right. All right. Hi, everybody. I'm Coach Michelle. I am a pediatrician and a run coach and founder of Mindful Marathon, where I help make running easy and fun for busy professionals. And today I have a very special guest with me. I have with me Dr. Carolyn Moyers. She is a board certified OB-GYN and mom of four. And we're just so excited to have her. Hi, Dr. Carolyn.
Hi, thanks for having me.
Can you tell us just a little bit about yourself before we get into the topics for today?
Absolutely. Yeah. I am a board certified OB-GYN, as you mentioned, and I'm in Fort Worth, Texas. And I have been out of residency for 10 years and spent 5 years in a rural health setting. And then we moved back to the city, and I have been doing OB hospitalist work and taking time for my young family. And as I have 4 boys, and I have just recently been working full-time as a hospitalist and starting my own practice. And my new practice is called Sky Women's Health, and it's comprehensive gynecology and osteopathy. So our niche is helping women in pregnancy and postpartum really feel their best, feel more realigned. And the type of things that we're seeing are either just the plain discomforts of pregnancy or back pain from back surgery between, pregnancy 1 and 2, or a motor vehicle accident, or gymnastics, history of injuries from gymnastics or horseback riding, or a number of things. And it's been so exciting because I did a neuromuscular medicine fellowship right during med school. And then I went to an MD residency. And so I haven't utilized these skills on a consistent basis because just busy in a OB-GYN practice, you're running from delivery and surgery, and I didn't have time to utilize it. So now bringing it all together and creating a practice that is authentic to the way I want to offer care to women, and giving them that time and space and partnering with their primary OB has been so much fun. It's been so rewarding to see the benefits, and having patients have their pain go from an 8 to a 2 or walk out pain-free is just remarkable, to see these skills put to work for women to enjoy pregnancy and postpartum and be able to live the life that they want. We're flying jet here.
I love what you do.
This is Micah.
Oh, hi. And the other great thing is that Dr. Moyers, she's very active and exercises a lot, and she swam and ran and cycled and lifted weights during all 4 of her pregnancies. And fun fact, she ran a half marathon and a marathon while pregnant. So I can't wait to hear about that.
Yes, that is true. I have always been really active. It's a stress relief. I took up running long distances in medical school, actually, to just deal with all the stress. And I had a friend who was a long distance runner, almost by nature. And so I could get us up in the morning and she would set the pace.
Love it.
And that's where I really learned a lot about training and doing distances. And so I ran my first marathon in my first trimester of my first pregnancy.
Amazing. I love it.
And, in the first trimester, I had been leading up to that, right? Training for up to 6 months. So I honestly didn't know I was pregnant when I ran the marathon.
That's just absolutely amazing. That makes the story just even more amazing than it was to begin with.
Right.
Okay. So today we are going to talk about running while pregnant and running postpartum, and address a lot of questions, concerns, maybe demystify some things a bit. So I suppose let's start with running while pregnant. I mean, maybe the basic question is it safe to run while you're pregnant, even if you don't know that you are?
I would say yes, and it depends. Now, in that first trimester, absolutely. I mean, if you have been running, if you're skilled, you've worked up to that, then yes, I think it's perfectly fine to run. I think the caveat would be, as we're getting closer to late first early second trimester where we might have, if there's a possibility of placenta previa or something of that nature, then I would not want you running. So I would say that would be the yes. And
yes, with a little caveat. Yes. Okay. Okay.
Yes. Yes. So you have to take into consideration all your other health concerns that might be complicating that. For instance, a diabetic who's been an avid runner and been able to maintain their glycemic control, that may be different in pregnancy, right? They may have a harder time with activity. And so that might need to be adjusted. So yes, it is safe if you are conditioned and you've been, sorry, I'm post-call, so all my words may not come out clearly.
You're good. And thank you for
Were
doing
you a runner
this
before
post-call?
pregnancy? If you are skilled and you are a runner before pregnancy, it is most likely safe to continue running. I would say that the biggest thing or biggest complications you would worry about would be like just balance, you know, as the uterus grows and that your low back, the lordosis increases, you kind of shift your center of gravity. You've got a lot of more laxity on board with all the hormones of pregnancy. And so you really worry about injuries if you're not on a steady surface. So I was not comfortable with trail running because I'm already a little clumsy. Yeah. And so I was on the street or the sidewalk because I needed a very level surface if I was going to run.
Yeah, no, that's a great tip as well. I think this is sort of along the same lines, but how much running experience do you need maybe like prior to pregnancy if you're going to continue running while pregnant? I often would not recommend taking up running if you have not done it before and then you just found out you're pregnant and you want to take up running. A lot of people ask me that one and I usually defer to their doctor, but I would recommend walking if they haven't been involved in the sport in a while.
I would agree with that. Yes. Okay. Like pregnancy is not the time to take up a new sport. Okay. Yoga, an exercise class that's organized, like, okay, that's fine. But an actual sport, like we're not going to go out and take up soccer all of a sudden or running and cycling or swimming. Like it's probably not the right time. But if you're a conditioned athlete, I don't know that there's any specific time frame, like keep in mind, you know, as scientists, we like to have all the data. We don't have a lot of data on this, right? But if you have a strong body and you have been exercising and you are comfortable running, then I think it's very reasonable to continue running in pregnancy, aside from any other complications. Mm-hmm. You know, if you have a placenta previa, please don't run. Okay. Walking is always safe and it's cheap. And you can do it anywhere.
Exactly. Okay. Yeah, I got it. All right. I love it. Okay. Now let's shift into, this is still maybe a pregnancy related topic, but just an equipment concern. One runner asked me, what is the best support for your bump? I am 22 weeks and have been getting ligament pain down one side of my bump. So keen to know what I could do to help this.
Belly band.
Okay. Ooh,
belly band. Okay. And I'm really kind of fond of the Belly Bandit. They have a website.
Okay.
They have just really soft fabric, so they're not scratchy and uncomfortable and like a men's work belt, you know? Yeah. And they have a variety of types. But it does really help support that lumbar and that, you know, the tummy as your bump gets bigger.
Ooh, okay. Oh, I love that.
It takes some of that stress.
Yeah, that's a great tip. Okay. We'll check that out. Can you get it? It's from their website or is it like Amazon or okay.
Yeah.
Got it. All right. I'll put the links maybe of the things that we talk about. We can always put those in at the end as well. Okay. All right. Now this is still in the equipment category. Do you have recommendations on sports bras for nursing moms?
Oh, I love this question. Okay. And I almost wore mine today just so that I could show you guys.
You totally could have if you wanted.
So yes. So just on a personal note, my breast doubled in size with pregnancy. Okay. And then nursing was like a whole other level. And so I tend to, especially with nursing, it's very uncomfortable when your breasts get enlarged and engorged. So one thing is make sure you pump or you feed before you head out for your run. Okay. And then the second, in terms of sports bra, I love, it's called Brooks. It's a Brooks brand. And it's very attractive and it's so supportive. And it has the little Velcro adjustable straps right here in front. So I basically lived in a collection of Brooks sports bras for like 6 years, as I have, you know, my little ones are 2, 5, and 7. So I was like constantly feeding somebody. I basically lived in them. You know, no addition, I couldn't go back to like regular nursing bras because they just weren't as supportive. So especially when nursing, it's nice to have a high support versus, you know, a lightweight. You don't want a bralette when you go running. You need some good support.
Yes, definitely. I have used, I've not been a nursing mom, but I love the Enel sports bra. That's what I usually recommend for my bigger busted ladies. But it's not, they don't have a nursing option that I know of yet. So, but that's my usual rec for everybody else. It's pretty high support. It's sort of, it has like front clasps and it sort of fits a little bit like a straitjacket, but it's comfortable and like holds everything in. So, okay. All right. Good and then, all right. One last equipment question. Any recommendations on jogging strollers?
Oh, I love this too. Okay. I love the Bob Jogger, the Bob stroller. I have the dual one. Here's the things that I like about it. It's got great shock support. So it's super comfy for the ride. You can have your front wheel either stationary or swivel, depending on your activity. And the handle on it has a little clasp where you can adjust its height. So, you know, for somebody who's super tall, you want it to be at a comfortable level. You want it have it at about hip level. And then you want to kind of lean forward, like leading with your upper body as you're trucking along. But we found that one to work really well with all of the kiddos. And it was nice because then my husband could adjust the height where it was comfortable for him to push it at 6'1" versus me, you know, at 5.5.
Oh, I love that. No, and I mean, props to everybody who runs with the jogging stroller. It is harder. For sure. You've never done it before. And yes, so I'm always
try the dual stroller when they're 2 and 4.
It's a lot of extra weight. So you get an arm and upper body workout as well. All right, great. All right. These are all great recommendations. When I go back and listen to this, I will write them down and I might just keep a little smart phrase at work because as you know, I'm a pediatrician and people ask me things like this at work too. So I will make myself a little smart phrase. Okay.
That's a good idea.
All right. Now, let's shift a little bit to some postpartum topics. So we received a lot of questions about when it is safe to start running after delivery. So when after giving birth can someone, you know, feasibly start to run again and when is it safe?
Great question. Starting back to running after delivery really depends on the route of delivery. And so if you've had a vaginal delivery, typically, I mean, you can start getting back to activity within the week after delivery. I wouldn't say go out for a hard run, but get out and start walking. Start with walking. You can take the baby in the stroller. So that's a great option. And then just build back up. I would say that you need to start back where you left off. So right at the end, excuse the noise, my toddler's just over here playing. So whenever you're at the end of your pregnancy, you're probably at the lowest point of your activity level and what you can tolerate. And that's kind of where you're going to work back up from. Do not anticipate being at your pre-pregnancy level right away. And you can expect that you're going to have some aches and pains in the low back and the pelvis as you get back to activity. That's normal. Listen to your body. Whenever you have those cues, stop, come back to it in a couple of days. Right? Give your body time to adjust and maybe get an osteopathic adjustment, maybe get realigned. Yeah.
I love that. I love the idea of just setting some, reasonable expectations. Like we're not going to get back to exactly where we were with our fitness, immediately. It's the same with coming back from an injury.
Yes. Or, and one of the other recommendations I always give moms is do not take your pre-pregnancy pants to the hospital to come home in. Not realistic. Just take your stretchy pants.
Love that.
Don't expect that your body is just going to be the same postpartum, even at 6 weeks postpartum. I mean, there's a reason they call it the fourth trimester.
Yeah, for sure. And those first couple of weeks, especially if you're breastfeeding, I mean, it's just a tiring time. So I love the recommendation to get out and walk for you, for baby, for everybody, and just to get some air and be active, but you don't have to do anything crazy. I love all of that. Okay, now let's backtrack. We were talking about when to get back to running after delivery, and we talked about vaginal deliveries, but we left out C-sections. So we're going to rewind.
Okay. Rewind. Okay. After a cesarean delivery, we want to make sure that you avoid strenuous activity. And everybody's definition of strenuous activity will be different. So let me break it down for you. Running, sports of any kind. Definitely do not want to be doing any lifting, CrossFit, none of that.
Okay.
Yoga, walking, take it nice and easy. You don't want to do anything that's really going to aggravate your C-section. It's a major abdominal surgery. Not to say that I want you laying on the couch. You're going to recover if you're up and about and doing your activities of daily living, going for some walks. Whenever you do get the pass from your physician, whether that's, you want to be at least 6 weeks and have clearance from your physician, right? Because if you've developed preeclampsia and you've got on blood pressure medicine postpartum, I don't really want you out there starting back to an exercise routine. So you have to be 6 weeks and be cleared by your physician to get back to running. And I would say in the first 2 weeks, you really just want to start out walking. And strengthening your core muscles. So yoga and walking as you start back into it, and then build up your strength and stamina over time. And the same rule as I talked about after a vaginal delivery, if it hurts, stop, listen to your body, come back to it in a couple of days, work on building up your strength. Don't beat yourself up if you're not at your pre-pregnancy level, because you're not going to be. You've had major abdominal surgery. You have created a whole human over the last year. Have some grace with yourself and just work up to it. And if you have any pain at your incision site, you want to get that evaluated and just kind of take it slow, nice and slow.
Yeah, I think that, the takeaways are really, be patient with yourself, listen to your body, take it slow. This is good advice for all of us, even if we are not pregnant or immediately postpartum. So,
true. Yes.
All right. Okay. Now, I have some anatomy questions. So, a lot of people want to know about diastasis recti, and I received a question about this from a friend of mine quite a while ago, and she was asking, she has this, and can she safely run with it, or should she see physical therapy? Does she need surgery to have it repaired? And a lot of people have questions about this, and I don't always have a good answer.
I'm glad that you're asking about this, because it is something that women are often concerned about. And it's not, we don't have a lot of hard data on this. Okay. Now, if you're looking at rectus diastasis, like in research studies, they're actually using little calipers to measure the distance between the two rectus abdominis muscles that run parallel, vertical on the body, right in the midline. And if you remember from anatomy, we've actually got a lot of abdominal muscles, right, that come in and connect there at the linea alba. So you've got the internal oblique, the external oblique, everything's coming and meeting there in the middle at the linea alba. And so that white line, you get a separation there, because as our uterus grows, it's stretching our abdominal muscles as well, right? They're getting they're getting a good stretch. And in some studies, they looked at women at 35 weeks, and 100%, in one study, 100% of women who were evaluated had diastasis at 35 weeks.
Oh, wow. Okay.
And by 6 months, only 39% did. So sometimes it will resolve spontaneously.
Okay.
Sometimes, proper exercises we always talk about, it's all interconnected. As an osteopath, I truly believe that, structure follows function and it's all connected. So, we can't think just about our core, but our legs and our hips need to be strong.
Yeah.
And our abdominal muscles to support the body, obviously, and our back. So yoga or Pilates or whatever you can do for core strengthening is really great. There was a study that I looked at recently. Oh, I want to come back actually. The diastasis is actually defined when the rectus abdominis muscles are 2 centimeters or more apart.
Okay.
And they test when we do an evaluation, it's a simple physical exam, and it's above the umbilicus or above the belly button, at the belly button, and below the belly button where they're looking. And it's usually varies a little bit as to where, which area it's worse. And so a pelvic floor physical therapist is a great person to help you develop a exercise plan to strengthen your muscles, because they'll do a full assessment of the hips, the legs strength, and your core muscles. So I went to a pelvic floor physical therapist just earlier this month, and I'll share that journey as I, learn more about it on Instagram. But one, it was out of curiosity, and two, I said, I've had 4 babies. I'm sure, I could benefit from this. And so it was really interesting to see how they did, the full evaluation to see I was not engaging my deep abdominal muscles.
Yeah. No, this is amazing. And I think a lot of people have some hesitation about pelvic floor physical therapy and don't know a lot about it. So I can appreciate just from wanting to know personally, professionally, but I think the journey will be very helpful for a lot of people. And that'll be on your podcast or on your Instagram, which you can tell us later where to find that. But I'm interested about your journey with that as well.
Yeah. It's really fascinating. Okay. So there are surgical options if it doesn't correct, but I would say that would only be an option if you are at the end of your fertility years, or if you have completed your family, then I would say, okay, it's reasonable to consider that. And I would say only if you've tried the more conservative measures, right? So maybe you've done exercises at home. And there was one study that I looked at. I want to tell you the exercises that they studied.
Oh, that's great.
Okay. So it's a randomized trial, and it looked at pregnant women assigned to postpartum exercise and then no exercise. And the intervention group had a decrease in that distance between the rectus abdominis muscles. So their diastasis improved, right?
Okay. Yep.
So the exercises they looked at were 6, or their assignment were 6. So it was draw in the abdominal wall on hands and knees. So kind of the cat-cow pose from yoga. Draw in the abdomen while laying flat on your back. A half plank. So I'm assuming that would be on your elbows doing a plank.
On your forearms. Yeah.
And side plank. Again, those obliques.
Yep.
Oblique sit-ups and straight sit-ups.
Okay. Maybe I can post, or if those are in that article, maybe we can post the link just so everybody has an idea about the exercises. That would be great. Or I can write them up too. We'll put it.
Yeah.
This will be great.
I can send something over to you. Yeah.
Okay.
Yeah.
Okay. This is great. I mean, I think this probably leads into a little bit about the pelvic floor as well. I have another friend who asked me, she was having some pain in her pelvic floor, like towards the end of her 3rd pregnancy. And she's worried that this is going to lead to some running barriers postpartum. I mean, does it necessarily mean that she'll have some trouble getting back into running if she has pelvic floor issues, while pregnant, or not necessarily? Tough to say.
Not necessarily, because there is a huge load on your pelvic floor when you're pregnant. An enormous load, a large head. There's a lot of pressure and weight going on that pelvic floor. So not necessarily. So with pelvic pain in pregnancy, it most likely will resolve postpartum. If it doesn't, then I definitely would recommend that you get in to see a pelvic floor physical therapist. Ask your OB-GYN who it is that they recommend. Because it really depends on what's the source of the pelvic pain if it hasn't gone away. And there's even vulvar pain specialists if you continue. Whoops, 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 whoops. Oh. No. Okay. You're okay. We tripped.
No.
It's okay.
Poor guy.
There are vulvar pain specialists who can help address if you consistently have pain that has not resolved. And there's even now pain management doctors, PM&R physicians who are specializing in the pelvic floor, specifically with techniques that are non-narcotic based. So they're looking at other alternatives to help. So there are so many solutions now. You do not have to suffer in pain. And I would not say that it should limit your physical activity.
Okay. No, I love that. I absolutely love that. And I'm excited to hear how she's doing. She actually delivered this third baby. So I'm going to be checking back in with her and see how her running is going. But if it's not going well, then I think the pelvic floor PT and just trying to see the specialists that you need to take care of yourself is probably the best plan of action.
Yes.
All right. Well, I think let's close with, I just wanted to get your thoughts on mom guilt. So that is a huge issue for a lot of my athletes. And it doesn't matter if you're immediately postpartum or your kids are older, but a lot of my athletes struggle with this and just taking even a little bit of time for themselves for exercise and maybe doing that without their kids. So I try to work with my athletes on reframing their thoughts about it and really trying to get to a place of, acceptance that we can have time for ourselves and for self-care, and that it really makes us show up as better moms and partners and aunties and all of that. But I would be very interested to hear your thoughts on this and how you help navigate moms through this.
Yes. Okay. Well, you've got it down. That's right. Say it with me. Self-care is not selfish.
Self-care is not selfish.
It's not. Moms need a break too. Just like kids need time out sometimes, parents need time out sometimes. And if you are going and exercising, strengthening your body, releasing endorphins, meditation with your feet to the pavement, I mean, this is gold, because you come back stronger, you come back more present, and your kids witness, oh, mom needs her exercise too, and look how strong she is. It's all good. And I would say have some grace with yourself, because your exercise routine will change with motherhood. For instance, with as many small kids as I have right now, I find it very challenging to get out for a run, because it works best for me if I do it first thing in the morning. So that means that I've got to set my alarm clock to get up before everybody else. And 9 times out of 10, they're still going to find me. Somebody's still going to wake up early. And I've been doing some high intensity interval training, HIIT training, and yoga for myself at home at 5:30 in the morning. Right. When I don't want to get out and run on the roads. Yeah. So just keep in mind that it will evolve and change over time. And maybe you get 2 runs in a week, whereas, before kids, you were able to run as much as you wanted, go on those nice long runs. And maybe now your runs are only on the weekend when a spouse is there. So I would say, ask for help when you need it. If you need a run or a walk, let somebody else take care of the kids. Don't be afraid to ask for help. And remember that self-care is not selfish.
Yeah, I love that. And being a little bit flexible with yourself and new Yeah. And the new schedule and all of that. It's so important. Okay.
And just knowing that your kids, even if they cry and they fuss when you're leaving the house to go exercise, is still okay. The minute you actually drive away, they're going to be completely fine. Or you get out of the, get on the street and you're out of sight, they're going to be fine. And, they'll be happy when you return and you'll feel great because you've released endorphins and you've taken care of yourself.
Oh, I love it. All right. This was amazing. Thank you. I mean, I learned a lot. I know everybody listening will have learned a lot as well. So Dr. Carolyn, please tell everyone where they can find you.
Sure. So at Dr. Carolyn Moyers on Instagram and Facebook. And then with my practice, I have started is at Sky Women's Health on Instagram and Facebook. And our website is skywomenshealth.com. And I also have a podcast you can find on any platform.
It's awesome.
Sky Women.
And shaking the far off of me.
And we'll put the links for all of those and how to find you in the notes for our little interview here. And you can find me, Coach Michelle Quirk, on my website, which is mindful-marathon.com. I would love to have you join our amazing group of runners. And if you are immediately postpartum and you are looking for a walk plan, there is a free one on my website that you can download to just get yourself active and get started back at it before you take it to the next step and go for a run. All right. So thanks everyone for joining us, and we will talk to you soon.